So you're not okay with mRNA vaccines? I'm confused where you are.
I think it's worth researching.
Okay.
That's about what anybody can say. There's some that say they're not worth researching. I don't think so. I disagree. I don't think it's the only paradigm, and this is where we get to some of the interesting stuff.
Talk to me.
This is where it gets interesting, right? Project Warp Speed came out. Trump put that together. Let's not forget, right?
Great. Okay.
This is my part. He's going for a win. A win's a win. Trump don't give a fuck.
I don't care as long as they're better, I don't care. But
Trump don't give a fuck is my point. The win's a win. He's very pro-vax. One of the treatments was a T-cell immunity, supposed to clear the virus. It's from Immune Bio.
Okay.
Dr. Pat Schoon. He was the only one of the 8 companies that are not on the mRNA paradigm.
Sure. Got it.
Now, the higher ups at these institutions were all pushing for the mRNA paradigm. There was a lot of decades of work, a lot of money at stake.
Yeah.
This was the narrative. This was the dogma. This was the orthodoxy. We got to go with that. Anything else, even if it's promising, we're not going to roll into this Operation Warp Speed. That's the kind of, even if it means it's in the best interest of the public, right? So this is the kind of dogma that I think is at the root of the problem, because you're not just pushing science, you're pushing one view of science and you're blocking other potential views of science. And the NIH got to control the purse strings for I know a lot of researchers that couldn't get funding, whereas others did, just because they were not part of the orthodoxy. And I don't think that's okay. I think the government should establish a framework for fair trade and competition, and not necessarily control purse strings to private industry. And that's where I think the grift, and for lack of a better word, all that other stuff gets convoluted into, oh, but you're dealing with patient lives and this and that. Yeah, you are dealing with patient lives. But you're dealing more appropriately with orthodoxies and who's going to benefit off of the established orthodoxy that's out there and the dogma that's going on.